Hi, I'm Bob Michaels. I'm your host of the Tacoma Eldercare channel here in Tacoma, Washington. I'm with a firm by the name of Smith Alling, and we have what's called an Elder and Disability Law section in our firm that has assisted seniors with all of their legal and medical needs for 30 years now. We are here with
Robin Shapiro.
And Peggy Anderson.
Peggy Anderson. I wanted to make sure we got that one right. I apologize. And they're with a company called Allied Health Advocates. And what we're going to be discussing is a concept known as medical advocacy. It's a fairly new concept. The idea is a wonderful idea that really needs to be put out there so people can become educated. This is within the context of this thing we call the healthcare system, which it can be troubling at best to figure out. I mean, we're so accustomed to this concept of the single entry door that if we want a hamburger, we drive to a drive-through, or if we want a cup of coffee, we go to there. But with regards to healthcare, regardless of what situation we find ourselves in, it can be very problematic in determining where you turn and how you turn. This is where Robin and Peggy come in with Allied in terms of they are your advocates to help you navigate that system and be there for you with every step of the way. But speaking of health advocacy, I know people sometimes reluctantly find it a challenge to come around to the concept of hiring a lawyer, but they understand that's part of the system. Once they find a good one there, that becomes a great resource for them. Mm-hmm. Same thing with a certified public accountant. And I would think it would be the same thing with a medical advocate, but
You would think so. However, this whole idea of medical health advocacy is very new. And so why did this concept even come about? Maybe we could even start there. And medical health advocacy really grew out of the patient empowerment movement. So patients becoming more active in participating in their own healthcare decision making. So why did that happen? It used to be that you went to the doctor, you went to the hospital, they told you what to do, you did it, and move on. But what patients are starting to understand is that our medical system is a business, and there are lots of things that feed into recommendations and decision making. But patients are left out of part of the equation. And so the reason why they can often benefit from a medical advocate is we are an unbiased source that works directly for them, the patient, to look at what their options are and make sure that all of their questions are answered and make sure that they're getting unfiltered information to make the best medical decisions possible.
Wow, well said. Robin, why don't you introduce yourself a little bit? Tell us how you came to be here, not just today, but in terms of medical advocacy and a little bit your background. And
sure.
Peggy, why don't you as well?
Okay.
So I co-founded the company Allied Health Advocates with Beth Droppert, who's a nurse. She's an RN. And my personal background is in health communications. This is the second company that I have founded. And my whole reason for being is actually to empower people in healthcare decision making. I've been fascinated about how to activate patients into becoming engaged consumers of their health, and I can think of no better, more important thing to be engaged in, to be smart about, than making healthcare decisions. And everything from what we eat to the doctors that we see, to the tests that we perform or have performed on us, to the medicines that we need to take for whatever conditions we might have. So my background, in addition to healthcare advocacy, is in biotechnology communications. So I used to work for Immunex. People might remember Immunex, biotechnology company, produced Enbrel and a couple of other drugs out there. So, but what really was exciting for me was to see patients getting better through medicine, through diet, and through decision making, and that's really what brought me here today.
Superb. Peggy, how about you?
And for me, I am a nurse, and I have been a nurse for 35 years or so. Worked at University Hospital, Northwest Hospital, worked inpatient, worked outpatient, worked acute care, did a fair amount of outpatient nursing, day surgery, so all different kinds of nursing, but I just really decided that at this point in my career, I didn't need or want to be in the hospital anymore. And when I discovered Allied Health Advocates, I was so thrilled to find out that there were people that could just walk alongside folks who are in crisis. And that is what I love to do in the rest of my life as well, with my children, my husband, my parents, but also to be able to then use my nursing background to walk alongside people to help them when they're in a crisis of any kind, medically, relationships with family, or as Robin has said, actually in the hospital, new diagnoses, but just at any point where they're overwhelmed, to allow me to come along and walk with them and help them in that process is just a huge privilege and an honor, and I love it.
So what's really interesting is that, so this is a new field, right? So there are fewer than 250 medical health advocates out there across the country.
Wow.
Yeah, so very new field. So most people won't have heard of a health advocate yet, but they will in the future. We are
because they're going to tune into the
That's right. That's
Eldercare
right.
channel for Tacoma and learn all about
That's
it.
right.
That's right. So Allied Health Advocates, Beth and I co-founded in 2008. We're the first health advocacy company here in Washington State. And what's interesting in listening to Peggy's story is that the majority of people who become health advocates have had some kind of medical background. And it used to be in hospitals and in the health system, the nurse was the person in charge of the whole patient. They were looking at things from the patient's perspective. The medical system today is structured very, very differently, but the people who go into health advocacy, by and large, the people that we have at Allied Health Advocates, are longtime nurses with 20 to 30 to 40 years of experience. We also have a physician's assistant. So lots of experience at play in taking care of the whole patient.
And also insurance advocates. Two
Yeah.
insurance advocates who are hugely helpful to people when they're in the midst of these crises. They're completely overwhelmed looking at their papers and their bills. And so the insurance advocates are really helpful in that situation.
So you can bring order to the chaos
Right.
with people in this confusing healthcare system that we have. Well, let's get out there how they get a hold of you. How do they call you? How do they find you?
Yes, so people find us by going to our website, www.ahadvocates.com. That's ADVOCATES.com. And our phone number is 206-377-3000. You can also Google us, Allied Health Advocates, and we come up on the search engines. And so we're there business hours, but if you call after hours, we will return your call promptly.
Super. Was there anything you'd like to share before we shut off?
Just, health advocacy, the whole health advocacy movement is all about empowering people to make the best medical decisions, and that's really what we do. We just provide additional information so people can be engaged and active in their own health care.
And one last thing, it's all about support. So it's as people are making these decisions, they feel supported along the way, and that there's someone there that can help them.
Super. And from a mechanical standpoint, once they're engaged with you and your company and they have a person assigned to them as their personal advocate, how does that relationship look, or how does that work? Are they in telephone contact? Do they go to appointments together? Do they just get together to discuss their medical records or their condition? Kind of walk us through that.
Yeah, it's really at the client's request. So we phone people, we meet in person, we go to medical appointments, we're on the phone with the insurance company trying to negotiate insurance, we go to the hospital, we go to people's homes, and we phone, text, email securely encrypted. We're obligated to keep everything private and secure, so we do that as well. But it's really up to the client. So somebody might want us, let's say a family member has a mother or dad who they want an advocate to visit regularly. So we might be there a couple times a week, accompanying them to doctor visits, and then if something is going, wacky with their weight, their blood pressure, we might be in touch with the doctor and make sure everything's smooth sailing there.
Oh, super. I just am so excited about medical advocacy just because in the clients I see, and whether it's in their home or in a facility, it's just the confusion that they have.
Yeah.
And they quite often want their doctor or want someone to come around and explain their conditions, and there's such a role to be filled for that.
Mm-hmm.
And at a very reasonable price. I mean, you guys charge by the hour, is that?
We're $150 an hour and $75 in travel time. And so we bill by the hour, or for clients that need more help, we can arrange a retainer.
And that sounds like a lot of money, but that's half the price of a lawyer. But we also
Or
have
less.
we also have to remember, though, the service or the value that brings to that. If you are just troubled and confused and not knowing what questions to ask or how to resolve these,
Mm-hmm.
that's a very reasonable value to have an advocate on your side to sort that out for you.
Yeah.
So Robin and Peggy, thank you very much for joining
Thank
us.
you.
Thank you.
We could go
Pleasure.
on and on about these
We
topics
could.
forever. It's just
Yes,
so
thank you
exciting.
so much.
And again, why don't you give your phone number and we'll
Sure.
send.
Allied Health Advocates, 206-377-3000, or on our website at www.ahadvocates.com.
Great. Thank you very much.
Thank you.
Thanks.